Hello, the title of this short video is Why Test Urine? And I suppose that if you had asked me as a houseman or any of the nurses on our medical wards, why test urine, we'd all have given the same answer, because we're told to. But actually, testing the urine really is an essential part of the medical examination of patients, both in hospitals and in general practice. And this video is basically going to answer three questions. Why do we test urine? What do we test for in the urine? And how do we do it? And the point is that testing the urine gives you an enormous amount of information about various parts of the body and various systems and disorders and diseases in those systems that are very far removed from the kidneys themselves. And in order to get a clear overall picture, we first of all have to understand how the urine is made and what its relation is to blood. Well, as we all know from our O-level biology, urine is made in the kidneys. And as we all know, the kidneys are two bean-shaped organs situated at the back of the abdomen, as you can see from this model here. As a matter of interest, they weigh about 150 grams, which in proper money is about 6 ounces. But this model reminds us of one very important thing, and that is that the kidneys receive an enormous amount of blood. In fact, about 1/4 of the blood coming out of your heart minute by minute, 1/4 of that blood goes through the kidneys, and the kidneys make urine by the process of filtration. So how does the kidney do all this magic filtering? Well, the answer is illustrated in this model here. Each kidney contains about 1 million filtering units. The filtering unit is called the nephron, and that's illustrated in white in this model here. And each nephron, or filtering unit, consists of two major parts. The filtering bit, that actually does the filtering, and the tubule bit, that alters and modifies the fluid that is eventually going to become urine. If we look at this second model here, we can see those two bits illustrated larger. Here is the glomerulus, the filter bit, and all the rest of the stuff is tubules that are going to alter the urine. And the tubules dip down in this bit here, which is called the loop of Henle. Before we go any further, we do actually have to look at the filtering unit, or the glomerulus, in great detail. And that's illustrated in this third model. The glomerulus really consists of a tuft of capillaries, and as the blood comes sort of roaring into the arteriole, feeding this tuft of capillaries, it's under quite high pressure. And these capillaries have got very thin walls, and they're deliberately designed to be sort of leaky. And so that what happens is small molecules like water, and glucose, and salt leak out of the capillaries into the beginnings of the tubule system. And the rest of the blood, the stuff that isn't going to be urine eventually, goes on back into the circulatory system. Now, the material that is filtered out by the glomerulus is called, logically enough, the glomerular filtrate. And there's a lot of it. In fact, there's an enormous amount of it, about 100 litres a day. And it would be a great waste to the body if all this was passed out into the urine, containing, as it does, many essential substances and things that we need. So what happens is that this glomerular filtrate is processed by the tubular system of the nephron, and the materials that are wanted, that are useful to the body, are reclaimed. And only the waste products, the stuff that is not wanted, is passed out into the outside world as the urine. And obviously there's not much of it compared to the 100 litres of glomerular filtrate that you start with. So that's how the urine is made. And there's one point I really want to sort of hammer home. And that is, from everything that I've said so far, you'll understand that all the materials in the urine come from the blood. And roughly speaking, there is nothing in the urine that isn't in the blood, or doesn't come from the blood. And that means that in many circumstances, the urine gives a jolly good indication of what's actually going on in the blood. Now, you may ask, if that is so, why don't we just do a blood test? Well, the answer is obviously that there are circumstances in which urine testing is relatively easy and convenient and painless, and blood testing is not. I mean, you don't need a needle to collect urine. It's painless, and it's simple, and it's accessible. So it has major advantages over blood testing in certain circumstances. So let's begin then with how we actually examine the urine. And we begin with the physical examination of the urine. and that means looking at it. That's easy to start with. And we look at the urine for colour and turbidity. So let's begin with those. Firstly, urine is normally a sort of light amber colour, and I have here a sample of normal urine. As you can see, it is a clear fluid of an amber colour. A very simple point, and one that escapes quite a lot of us, is that colour varies. And it varies partly with what you're doing with the rest of your fluids. In hot weather, for instance, when you're sweating a lot, you're losing a lot of fluid through your skin, the urine is more concentrated and it is darker. And I have here a sample of dark urine. This is hot weather urine, okay? In cold weather, you lose much less in the sweat and the urine is much lighter in colour. I know this sounds terribly obvious, but it is a very important point, because a lot of patients say to doctors and nurses, my urine is very strong, and I've noticed that. And strong to doctors and nurses, to medical people, rings an alarm bell. They think, aha, maybe they mean an infection. Most people, when they talk about urine being strong, may well mean simply that it's concentrated, usually because they've been sweating a lot. Now, normal urine is often clear, but not always. Another simple point that often escapes us. Sometimes the urine, when you pass it, particularly first thing in the morning, is cloudy. And this is another example of normal urine, and it just happens to be cloudy. And urine passed first thing in the morning may well be cloudy. This cloudiness is often due to deposits of phosphate or sometimes of urate. So, given a urine that's cloudy, how can you tell whether this is normal cloudiness or whether, for instance, it's infected? Well, the answer is what you do second in the physical examination of the urine, that's to smell it. Now, normal, freshly voided urine, I'm not kidding, smells characteristic, but it doesn't smell unpleasant. You can tell it's urine, but it doesn't smell foul. Infected urine, on the other hand, does often smell foul. And a very recent paper suggested that urine that was cloudy and had some bacteria in it, but that did not smell foul, did not have serious infection, and that urine that had bacteria in it and that did smell foul was seriously infected. So smelling the urine for foulness, for smelling of infection, is actually a very important thing to do. Another important thing that you can smell in the urine is, of course, the ketones that are produced by diabetic patients, or patients who have been fasting or vomiting or something like that. And these ketones smell a bit like sort of pear drops, or really a bit like nail varnish, possibly. Some people are very good at smelling ketones, and some people are not very good at smelling ketones, and it depends on the sort of the parents that you have as to whether your nose is good at smelling ketones. As a matter of interest, I happen to be not very good at smelling ketones. So smelling the urine for infection and for ketones, very useful. Now let's just go back to colour for a moment or two, because there are some things that can produce changes in the colour of urine which you need to be aware of. Of course, the most important is blood. Blood in the urine, very significant, and blood in the urine usually produces a sort of pinkish discoloration like this. You need to be aware of one little warning, that people who eat tons of beetroot, ordinary beetroot, also have a reddish or pinkish discoloration to the urine, so not everything that is pink in the urine is blood. There are a few other things that can cause discoloration of the urine. Patients who've had certain x-rays where they inject blue dye into the lymphatic vessels in the foot, the lymphogram, they pass blue urine for a time. If they haven't been warned about it, it can be a bit alarming. And patients who've had certain kinds of investigations where they inject fluorescein, a fluorescent dye, into the blood, they can actually have bright green or bright fluorescent day glow urine like this. And speaking as somebody who has had such a dye test, it can be quite alarming or even amusing to pass so much day glow urine. So that basically tells you a little bit about some of the things that colour the urine. So now we've looked at the urine, we've looked at colour, and we've looked at turbidity. We've also sniffed the urine to detect infection or ketones. What next? Well, the next thing is the specific gravity. Now, specific gravity is really an overall measure of how much stuff there is dissolved in the urine. If you can imagine starting off with a pint, let's say, of ordinary distilled water, and you add half a pound of sugar and a bit of salt and a whole load of other stuff and dissolve it up, at the end of that, the pint of water is actually going to weigh more than it did to start with because of all the stuff that's dissolved in it. And the specific gravity is actually a measure of the amount of stuff that's actually dissolved in it. The important thing is, of course, that it varies. as we've said, concentrated urine passed in hot, sweaty summer days will have a higher specific gravity. Dilute urine passed in the cold winter days will have a lower specific gravity. And often the specific gravity and the variation in specific gravity tells you a little bit about the concentrating and diluting abilities, if you like, of the renal system. So after looking at the urine and testing the specific gravity, we then go on to the chemical testing of the urine. Well, now, when we come on to the chemical testing of the urine, there are an enormous number of materials that you could actually test for in the urine if you had the time or inclination or resources. But in fact, there's only a small number that we test for routinely, and these are tested for routinely in hospitals and in general practice. And the first of these is the pH. And the pH is quite simply a measure of the acidity or the alkalinity of urine. Normally, freshly voided urine is just slightly acid. It has a pH of around 6, though through the course of a day it can vary between 5 and 8. Now, urine can become more acid in certain conditions, such as starvation, dehydration, and diarrhea. When it becomes more acid, the pH goes down below 6. It becomes more alkaline, for instance, when there's a urinary tract infection. Now, obviously, with some of the abnormalities that we'll be covering later, there are an enormous number of different disorders or diseases that could be the cause. We've only got time, really, just to give a few examples. But before that, you should become familiar with some of the words we use, some of the terminology of urinalysis. Now, you're probably already aware that any word that ends in emia refers to the blood. Septicemia means an infection of the blood. Similarly, in urinalysis, any word that ends in urea relates to urine. So, proteinuria means simply protein in the urine. Other useful terms are polyuria, poly meaning a lot. Polyuria, a lot of urine being passed, for instance, in diabetes. Dysuria, dys means discomfort or pain. Dysuria, discomfort or pain on passing urine. Anuria, an means totally without. Anuria means cessation of urine production. So let's now move on to the second part of chemical testing, looking for protein. Protein in the urine, proteinuria. Now, normal urine does not contain sufficient protein to give a positive test result. This is because the protein molecules are too large to actually pass through this very fine filter in the glomerulus. And any increase in the amount of protein, particularly the smallest protein molecule called albumin, is one of the first indications of renal disease. And it's extremely important. And I always say proteinuria is a bit like pregnancy. You can't be slightly pregnant. You're either pregnant or you're not pregnant. And proteinuria is something that, by and large, has to be taken as seriously as that. Proteinuria needs to be explained. Now, proteinuria may be present in several conditions. Glomerulonephritis, for instance, which is an inflammation of the glomerulus. It can be present in hypertension, high blood pressure. It can be present in urinary tract infection and in the toxemia of pregnancy, preeclamptic toxemia. Early detection of albumin in the urine could allow very early investigation. You can latch on to something early, and early treatment, of course. And it may even prevent the patient from later on unnecessarily losing the use of their kidneys. So it's really something to watch out for. After proteinuria, let's move on to glycosuria. Glycosuria means glucose in the urine. Just to remind you, glucose is, of course, the body's main source of energy. And it's the most common sugar ever found in the urine, although there are a few other sugars that are found, such as lactose and fructose and galactose, and as a biochemist once said, God knows. They can be found in certain circumstances. Now, the most frequent cause of glucose in the urine, I'm sure you all know, is diabetes mellitus. Just to give you an idea of scale, in the UK, there are about 600,000 diabetics. And we think there are probably as many again who haven't yet been detected, who might be diabetic. In non-diabetics, the level of glucose in the blood is regulated by the hormone insulin. And as you remember, insulin is secreted by the pancreas in response to a rise in blood glucose. That happens after a meal. The blood glucose goes up, the pancreas puts out the insulin. And so, in normal individuals, the blood glucose is maintained within very, very narrow limits by allowing the glucose to enter the cells of the body from the blood. Now, if the production of insulin is slowed or it stops, then the level of glucose in the blood rises. And when it rises above a certain level, a level that we call the renal threshold, it spills over into the urine in large amounts, and then we can detect it with our dipsticks. Now, just one important point here, that there is a normal renal threshold, and so if the blood glucose rises, it can actually spill over. It's just an important point that a few people have a low renal threshold, which means with normal levels of glucose in the blood, they have some glucose spilling over into the urine. They're not diabetic, they just have a low threshold and have glucose in the urine, glycosuria, without diabetes. Just a little caution there. But the majority of people with glucose in the urine, glycosuria, are diabetic until proven otherwise. Let me hammer this point home. Early detection and monitoring of diabetes is very important, because it is the high levels of blood glucose, hyperglycemia, that can actually cause severe damage to the eyes and the kidneys and the blood vessels, and in extreme cases can result in blindness or death. Very simple message. By testing the urine for glucose, you might easily be saving a pair of eyes in the future. A simple point, but absolutely valid. Next, after glucose, we test for ketones. So, ketonuria. Well, when insulin is not available for use by the body, as occurs in diabetics, for instance, the body uses its two alternative fuels, protein and fats, to provide energy. And ketones are chemicals formed by the body when it metabolizes fats and fatty acids. And ketones are excreted into the urine as the blood passes through the kidneys. Now, if there are lots of ketones, excessive amounts of ketones in the blood, the level of ketones in the blood can build up and produce coma and even death. And detection of ketones in the urine, ketonuria, is important, not only in diabetics, where it indicates that treatment is needed like fast, but also in a variety of surprisingly common conditions, apart from diabetes, in fevers, in conditions of starvation, anorexia nervosa, in severe diarrhea or prolonged vomiting. In any of those, ketonuria can be important. Now, bilirubinuria, the detection of bilirubin in the urine. Bilirubin is a bile pigment, and it's a breakdown product of hemoglobin. It's what is produced when hemoglobin that's done its business in the blood is broken down. And it's normally excreted from the body via the liver and the gallbladder. And diseases or disorders of the hepatic system can actually block this route of excretion, and they can cause bilirubin to sort of build up in the blood and then be excreted into the urine. And when the level of bilirubin in the blood rises high enough, it causes the skin, and particularly the sclerae of the eyes, the white bits, to become coloured yellow, and this is of course the condition that we all know as jaundice. And the point is that bilirubinuria can be detected before the stage of clinical detectable jaundice, and so it's an important diagnostic sign of liver disease. Together with urobilinogen, another bile pigment, bilirubin provides a very useful device in the diagnosis of hepatic diseases, for instance, in cirrhosis of the liver, in infectious hepatitis or serum hepatitis, in gallbladder disease, when a gallstone comes out of the gallbladder and blocks the common bile duct, in cancer, a carcinoma of the head of the pancreas, which also blocks the common bile duct, or when the liver is congested with blood in congestive cardiac failure. In all of these, testing for the bile pigments in the urine can provide a very early and a very useful clue in picking up disease. Now, hematuria, or blood in the urine. Now, blood in the urine is obviously serious. It's something that cannot be ignored at all. And what I said about proteinuria being a bit like pregnancy, either proteinuria or no proteinuria, applies even more to blood. Blood in the urine is not something you can ignore. Now, blood in the urine can be detected as red blood cells in the urine, hematuria, or as free hemoglobin from ruptured red blood cells, hemoglobinuria. But the important thing here is that blood can be present in the urine in minute amounts that cannot be seen with the naked eye, that don't contribute to a pink colour. And I'm now going to demonstrate that to you with the use of my very own blood, which I shall produce from my thumb. Have I produced? Yes, a tiny, tiny drop of blood. Let's just do that again a little bit more dramatically. Here we have a tiny, tiny drop of blood. And in my right hand, I have a large glass of water which is completely clear. I put the tiny, tiny drop of blood into the urine and I swish it around a little bit, shaking off a few million red cells only. Now, this water is completely clear and you would never know there was any blood in it at all unless you test it. And all you do simply is just to dip a dipstick into it, take it out like that. Now, this is the one that I've dipped, and I want you to look at the second pad from the end here and compare it with one that hasn't been dipped in water. Look at this second pad. It's gone deep green, registering lots of blood in that water, compared to the rather nice, modest cream colour that was there beforehand. And this shows quite simply that you can detect blood in urine even when you can't see it with the naked eye. The situation where blood is present but is not detected by the naked eye is called microscopic hematuria. And microscopic hematuria, tested by such screening tests as this, can reveal many important things. It could reveal cancer of the prostate, or cancer of the kidney, or the bladder, for instance, in patients who don't have any symptoms at all. And recently, trends have indicated that there's actually an increase in these conditions. And like many cancers, early detection and early treatment might be life-saving. Hematuria, blood in urine, is also a well-known complication of anticoagulant therapy, and regularly testing the urine for the presence of blood is a means of helping in the control of anticoagulants. Now, causes of a positive test for blood in the urine can vary, but in all cases, the presence of significant amount of red blood cells or hemoglobin indicates that there must be an underlying cause. It's serious. And with conditions such as cancer, we can't afford to take a chance. The point is that red blood cells, actually holding the hemoglobin in them, may not always be seen under the microscope by the man in the laboratory at the hospital, because red blood cells in urine can break up or lyse. And in those cases, you have the strip test that I just showed you, which is positive, whereas the man looking at the urine under the microscope doesn't see any actual red blood cells in the urine. The strip test is right. There has been blood in this urine, but the red blood cells have lysed, so the man in the lab can't see them. So hematuria, extremely important. Now, bacteriuria, the presence of bacteria in the urine. Normally, urine in the bladder is sterile, and I know we think of urine as dirty. In fact, the exact opposite. It is clean, and it is, remember, a readily available source of clean, sterile fluid in the desert or other similar emergencies. And the presence of bacteria in the urine suggests a urinary tract infection, such as cystitis. And urinary tract infection, or UTI, can lead to serious kidney damage if it's left undiagnosed and untreated. And the earlier it occurs in your life, and the more frequently, the more serious the renal damage that will develop later in adulthood. Significant urinary tract infection can be present in patients who are asymptomatic, who have no symptoms. In fact, estimates suggest that up to 5% of the groups that are at risk, schoolgirls for instance, are reported to have asymptomatic bacteriuria. Now, chemical detection of bacteriuria can be established by a test for testing for the presence of nitrite. Nitrite is stuff that isn't normally present in urine, but where there are bacteria in the urine munching away at various other chemicals, they produce nitrite, and nitrite can be detected on a special pad where you get a pink colour developing, and that indicates that there are significant numbers of bacteria in the urine munching away and producing nitrite, a valuable test. Urinalysis, examination of the urine, can really reveal a whole lot of conditions, of chronic conditions and acute conditions. And the development of these chemical reagent strips has really simplified enormously the development of convenient testing methods. And although these strips appear very simple, they're cream and they go green or they go pink or whatever it is, they appear terribly simple. They're actually very complex chemical materials. They're actually a sort of whole little laboratory mounted in a tiny little pad, because there are chemical substances in these pads that change colour when the desired compound is present in the urine, whatever it is, blood, or nitrite, and so on. Now, in order to get the best results from the chemical testing of urine using your dipsticks, there are a few simple rules and precautions that you need to know about. The first one's so obvious, but it's still important. Always ensure that the urine is collected in a clean, dry container, not a teacup with a bit of sugar in it, not a milk bottle with a load of acid in it, something that is clean and dry. Secondly, do the testing very soon after you collect the urine sample, because if you leave the urine lying around in its container, there can be chemical changes occurring in the urine itself. And these may ring all kinds of alarm bells registering false positive tests when alarm bells didn't ought to be rung. Even more important, you can get false negatives, because bacteria in the urine might use up sugar that is in the urine, and then when you test it, you don't detect sugar, but the sugar was there before, so test the urine freshly. The technique for using these kind of strips is very simple indeed, but again, there are just a few simple rules and precautions which I should warn you about. The first one is to check the expiry date on the bottle to make sure that the strips are still in date. That's quite important because these strips have a limited shelf life, and after they've been around for a time, they may not be as good as they were at detecting the substances. This one's got nearly a year to run, so we're okay. Next, when you've taken a strip out, always replace the lid back on the bottle and tighten it up. Always do that after you've taken a strip out. Thirdly, don't remove the desiccant from the bottle. And I'll show you what the desiccant looks like, as I've taken it out of this bottle to show you. It's this stuff here. It looks like the stuff, the salt in the Smith's Crisp packet. And its job is to absorb the moisture from the air inside the bottle. Always leave it inside the bottle like that, so that the strips inside the bottle are protected from the air and protected from the water, and they won't deteriorate. Now, with those simple rules, when you use these tests, you will be successful, and the results that you record will be valuable and useful. So now, let's look at how we actually perform the urine tests. So, here's how to do the urine test properly. You take the urine in the clean, dry container, and you take the dipstick. Now, what you're going to do is immerse the dipstick into the urine so that all the reagent pads, every single one of them, is covered by the urine, and immerse just for 1 or 2 seconds only, just like that. Straight in, all the pads covered, 1 or 2 seconds out. And as you pull it out, wipe the excess urine off the strip onto the rim of the vessel like that. Then hold the strip horizontally. Hold it horizontally for 2 reasons. Firstly, to stop all the colours merging with each other, and secondly, to stop the urine flowing backwards along your fingers and up your arm. Then, having done that, you then compare the colours on these test pads with the label or the chart that you have handy. Now, if you want a straight qualitative result, just a yes or no result, you can compare the pad with the chart anytime between 1 and 2 minutes. But if you want to know exactly how much of the various substances there are in the urine, then you need to compare at exactly the right times. You ignore the specific gravity to begin with, the one at the bottom, and you do the rest in the exact order in which you've heard me talk about them. You start with pH, then protein, then glucose, then ketones, bilirubin, blood, and urobilinogen, and then finally finish up with specific gravity. And when you've taken all those results, also goes without saying, record them in the patient's notes. They are as important as the blood pressure or the temperature, and you need to have those figures handy for further referral. And there's one test I haven't told you about, and that's a test based on a tablet rather than a strip for glucose in the urine. And it's often used for monitoring diabetics at home. It's called the CliniTest test, and here we're going to see it done properly.
The first step is to collect his urine in a clean, dry container. A small amount is then drawn up into the special CliniTest dropper, and exactly 5 drops are dropped into the CliniTest tube. Always ensure you use the correct dropper and tube. The dropper is then emptied and rinsed out several times with tap water. Then some fresh water is drawn up into the dropper. Now exactly 10 drops are added to the tube. Note how he holds the dropper vertically and keeps it away from the sides so that the drops go straight to the bottom. He then takes out a CliniTest tablet by removing the lid and shakes out a single tablet. The tablet should never be handled, and so John, using the cap, transfers the tablet from the bottle to the tube. Always replace the cap as quickly as possible to stop air entering the bottle. The tablet then reacts with the liquid and bubbles up. The mixture is actually boiling, and the tube becomes quite hot, so always leave it in its holder at this stage. If the liquid goes orange, even for a second when it's boiling, it means there is more than 2% sugar in the urine. The boiling stops, and after waiting 15 seconds, the tube can be removed from the holder. The mixture in the tube is then shaken gently several times in order to get an even colour, and the colour is compared against the Clinitest colour chart. Compare the colour carefully and note which colour block most closely resembles the colour in the tube. In this case, John has 0.5% sugar in his urine.
Now, I know I've told you a lot, and your head must be spinning with all the information you've heard, but don't panic, because all the information I've told you is actually covered by a small technical information manual, and that'll provide you with a permanent reference book on urine testing. Well, let's just summarise a couple of things. Urine testing is really important because it tells you about things going wrong in all the different parts of the body. And it is you, the tester, the person that actually tests the urine, that is providing the doctor with extremely valuable information. And that information that you get is as valuable as any other observation you will make on the patient, be it temperature, pulse, blood pressure, whatever. That is valuable information. And if you do it right, you will be telling the doctor interesting and important facts. So do it right, because it's worth it.